Hey, it's your friend here from Book Podcaster.
Hi there.
Just wanted to say, if you're tuning in, especially, you amazing nursing students out there, take a deep breath.
Seriously.
Yeah. The amount of information you're juggling, you could probably launch a small rocket, right?
No kidding. It's a lot.
So we're about to take a little detour from all the must-knows and do a deep dive into something super important, but like we're going to tackle it like we're just chatting.
Yeah, no heavy textbook vibes allowed today.
Exactly.
Today, we're really zeroing in on understanding substance-related and addictive disorders.
Okay.
Think of this as your shortcut to the key insights. We're pulling from Chapter 32 of Psychiatric Mental Health Nursing, Concepts of Care in Evidence-Based Practice. That's the Townsend and Morgan book, 10th edition.
Gotcha.
Our goal isn't, to memorize every single detail, but to really get what's at the heart of these conditions.
All right. So our mission basically,
Right.
if you choose to keep listening and, hey, you're here, so you already have,
Right.
is to get a solid handle on the how, what, and why of these disorders. We're talking the physical stuff, the mental and emotional pieces.
Social influences.
Yeah, social influences, what makes some folks more at risk, how we can step in to help, and what the road to recovery looks like.
Exactly.
Ready to dive in? Let's start with the basics. What exactly are these disorders?
Okay. So, in essence, substance-related and addictive disorders. They're conditions where someone develops this persistent pattern.
A pattern.
Yeah, a pattern of using substances like alcohol or drugs or, engaging in behaviors. Gambling is a prime example.
Oh, yeah.
To the point where it seriously messes with their daily life and their overall well-being. It's more than just an occasional slip-up.
Right. It's not like having one too many slices of pizza that one time, like you said.
Precisely. The crucial thing to recognize is the ongoing negative impact. So within this broad area, we have substance use disorder. This is a continuous pattern of alcohol or drug use that leads to significant problems like in how they function, or it causes them considerable distress.
So how do you know?
Well, you kind of ask yourself, is this use getting in the way of their job, their relationships, their responsibilities? Are they facing negative consequences, maybe health issues, legal trouble, but still can't stop? That's a key indicator.
Okay. Okay. And the word addiction, that pops up a lot. How does that fit with substance use disorder? Is it the same thing?
That's a great question. Addiction generally refers to a state where someone has developed a psychological or even physical dependence on a substance or a behavior.
A dependence.
Yeah, and this dependence creates this really powerful, often uncontrollable urge to use the substance or do the behavior, even when they're fully aware of the harm it's causing.
Can you maybe paint a clearer picture for us? An example?
Certainly. Imagine someone who drinks alcohol so heavily, so frequently that they regularly experience blackouts.
Well,
Despite these memory lapses, potential damage to their health, they continue this pattern. That's a substance use disorder.
got it.
Now, think about someone maybe compulsively using heroin, even though it's costing them their job, straining family relationships, impacting their health negatively. The craving is just overwhelming.
Right.
That's also a substance use disorder. And in many cases, it includes addiction, that intense physical and psychological need. So the key insight here is really the harmful pattern of use despite negative consequences, often driven by dependence.
Got it. It's that compulsive drive and the real-life fallout that really defines it. So who's more likely to develop these disorders? Is it just like random, or are there specific vulnerabilities?
It's definitely not random, no. There's a complex interplay of factors that can increase someone's risk.
Okay.
We often categorize these into biological, psychosocial, and environmental influences. Think of it like a combination lock several tumblers need to align.
Okay, let's look at the biological tumblers first. What role do our genes and, our bodies play?
Biologically, genetics can indeed play a significant role. Some people might inherit a genetic predisposition, making them more susceptible.
Makes sense.
And furthermore, substances have this powerful effect on the brain's reward system. They can trigger this flood of pleasure that reinforces the behavior, making it much harder to resist cravings down the line.
So it's almost like the brain's pleasure center gets hijacked. Is that a fair way to put it?
Precisely. That's a great way to think about it. Repeated exposure can actually lead to changes in brain structure and function.
Really? Actual changes?
Yes. It affects how the brain processes pleasure and responds to, natural rewards. This neuroadaptation makes it harder to feel pleasure from everyday stuff and intensifies the craving for the substance.
Wow. Okay. And what about the psychosocial tumblers? The mental and social influences?
Psychosocial factors are incredibly influential. Trauma, for instance, can significantly elevate the risk. People might turn to substances as a way to numb painful memories or cope with intense emotions. Mental health disorders like anxiety and depression also frequently co-occur.
Ah, the self-medication idea.
Exactly. It's often a case of trying to self-medicate. Then there's peer pressure and the social environment. If substance use is normalized or even encouraged in someone's social circles, well, it can be much easier to start and much harder to stop.
That makes a lot of sense.
Yeah,
Yeah, if everyone around you is doing it, probably doesn't feel like such a big deal, at least at first.
right.
What about the environmental factors? What external stuff contributes?
Environmental factors include things like stressful life events, losing a job, a difficult breakup, financial strain. These can act as triggers or worsen existing use.
Sure.
A family history of substance abuse is also a major environmental factor. Growing up where substance use is prevalent can normalize it, increase risk through learned behaviors, and just increase accessibility.
Makes sense.
And lastly, cultural norms and societal attitudes towards substance use can either be protective or contribute to the problem.
It sounds like a really complex web of factors.
Yeah.
The source mentions a woman named Jane. How did these factors play out for her?
Jane is a perfect illustration. She was 32 years old, strong family history of alcoholism.
Okay, so the genetic piece.
Right. She started drinking socially in college, which, as we know, is quite common. But for Jane, it quickly progressed to binge drinking.
Oh, wow.
This eventually led to her losing her job and having significant health problems.
So what's the takeaway there?
The key takeaway from Jane's situation is how multiple vulnerabilities converged. Her genetic predisposition, combined with likely underlying emotional struggles, maybe depression, created this sort of perfect storm. It increased her susceptibility to alcohol dependence. It wasn't just one thing. It was the combination.
That really puts it into perspective. Okay, so someone starts using substances. What are the early warning signs? The things that might signal a developing problem?
Yeah, there are several red flags to watch for. They often fall into like physical, psychological, and behavioral categories. It's really about recognizing a pattern of change.
Let's start with the physical signs. What might someone observe?
Physically, well, if someone tries to cut back or stop, they might experience withdrawal symptoms.
Like what?
These can range from mild, like sweating, tremors, to more severe, like nausea, vomiting, even seizures, depending on the substance and how dependent they are.
Okay.
Other physical signs could be changes in appearance, maybe unexplained weight loss, poor hygiene, bloodshot eyes, or slurred speech.
And what about the psychological shifts? What kind of mental or emotional changes might occur?
Psychologically, you might see significant mood swings, increased irritability, anxiety, depression, maybe even paranoia.
Hmm.
Their thought processes might seem disorganized. They might struggle with concentration, memory. They might also develop this preoccupation with getting and using the substance, almost ignoring other things.
Those all sound like things that could potentially be attributed to other issues, though. That must make it challenging to pinpoint substance use.
That's a critical point. Absolutely. That's why looking at the bigger picture, the combination of physical, psychological, and especially behavioral changes is so important.
Okay, so behaviorally, what should we look for?
Behaviorally, you might notice someone neglecting their responsibilities. Work, school, home.
Right.
They might start withdrawing socially, isolating themselves from friends and family who don't use. Engaging in risky behaviors they wouldn't normally consider is another big one,
Right.
like driving under the influence, sharing needles. And they might start having problems with the law or with their finances.
The source gives an example of Mark. What were the behavioral changes people noticed with him?
Right, Mark. He was 28, started showing several concerning behavioral signs, frequent unexplained absences from work, significant unpredictable mood changes that his family noticed, and there were indications he was stealing money, strongly suspected to be funding his opioid use.
Right.
His family also saw these sudden financial issues and just a general shift in his personality and behavior. Things just weren't adding up, outside the context of potential substance use. The key insight with Mark is those noticeable disruptive changes in his normal life patterns.
So if you're a nurse interacting with someone who might be facing this, how do you even begin to address such a sensitive issue?
Yeah, that's crucial. Effective nursing assessment is absolutely fundamental. It really lays the groundwork for providing the right support and care.
Okay.
Nurses need to be good at recognizing those indicators we just talked about, physical, emotional, behavioral. But the approach is just as critical as the observation.
What are the essential components of a nursing assessment in this area then?
Well, a comprehensive assessment involves taking a detailed history of the person's substance use,
What does that include?
like what substances they're using, how often, how much, for how long.
Yeah.
It's also vital to explore their family history of substance use. We know that's a risk factor.
Right.
And importantly, asking about any co-occurring mental health concerns is essential because these often intertwine. Understanding their social support, any past treatment attempts, that's all really helpful too.
Are there specific tools or questionnaires nurses use to help with this?
Yes, definitely. There are evidence-based screening tools. They provide a structured way to identify potential problems.
Like what?
For alcohol use, the CAGE questionnaire is widely used. It's brief. For drug use, there's the DATAST, the drug abuse screening test.
Okay.
These tools can help standardize that initial screening and flag people who might need a more in-depth assessment. But it's important to remember they're just tools. You need to use them in context with the whole clinical picture.
That sounds really practical. But you mentioned how sensitive this topic is. How can a nurse approach this conversation without making someone defensive?
This is where empathy and a completely non-judgmental approach are paramount. Just absolutely key.
Why is that so important?
Because people struggling with substance use disorders often carry this heavy burden of shame, guilt, fear of being judged, fear of consequences, fear of disappointing people.
Yeah.
If a nurse comes across as accusatory or critical, the patient will likely clam up, become defensive, be less willing to be honest.
So what's the goal?
Creating a safe, trusting, supportive environment is absolutely essential. It's how you build rapport and get accurate information. It's about approaching them with genuine concern for their well-being, not accusation.
That makes perfect sense. You're trying to build a bridge, not a wall.
Mm.
Okay, so let's say someone has been identified as having a substance use disorder. What does this treatment landscape typically look like?
Yeah, treatment is rarely a one-size-fits-all situation. It usually involves a combination of different strategies, really tailored to the individual's needs and the specific substances involved. Think of it as a personalized recovery plan.
What are some of the common components you might see in those plans?
For some people, the first crucial step is detoxification, often called detox. This is a medically supervised process. It's designed to safely manage the withdrawal symptoms that happen when someone stops using substances they've become dependent on. Medical monitoring is vital here because withdrawal can sometimes be physically dangerous.
And what happens once someone has gone through detox? That's just the first step, right?
Right. Detox mainly addresses the physical dependence. After that, the focus shifts to the psychological and behavioral aspects. Pharmacological interventions or medications can be incredibly helpful here.
Medications for addiction, how does that work?
They can help manage cravings and withdrawal symptoms, especially for things like opioids or alcohol. Examples include methadone, buprenorphine, naltrexone for opioid use disorder, and meds like acamprosate, naltrexone, and a sulfiram for alcohol use disorder.
So medications can actually help with those intense psychological urges.
Yes, they work in different ways. Some can reduce cravings directly. Others might block the euphoric effects if the substance is used, which reduces the motivation to use. And others can just alleviate the uncomfortable or dangerous symptoms of withdrawal, making it easier to stay abstinent.
What about the role of therapy? That seems like it would be a big part of the picture.
Oh, absolutely. Psychotherapy is a cornerstone of treatment. Cognitive behavioral therapy, or CBT, is a very effective approach.
What does CBT do?
It helps people identify and change those maladaptive thought patterns and behaviors linked to their addiction. Motivational interviewing is another really valuable technique.
How's that different?
It's more client-centered. It helps people explore their own reasons for wanting to change and builds their internal motivation for recovery. It's kind of about guiding them to their own solutions rather than telling them.
We often hear about 12-step programs like AA and NA. How do they fit into this treatment puzzle?
They fit in really well for many people. Programs like Alcoholics Anonymous and Narcotics Anonymous provide crucial peer support and a structured framework for recovery.
Peer support seems key.
It's huge. They offer a community of people who share similar experiences, which can be incredibly powerful in reducing feelings of isolation and fostering a sense of belonging. The 12-step model emphasizes concepts like acknowledging a lack of control, seeking guidance, taking personal inventory, making amends, and helping others.
The source mentions John. What kind of treatment approach was he involved in?
Right, John. He was dealing with an alcohol use disorder. He was actively participating in a 12-step program like AA,
Okay.
and he was also receiving CBT to help him understand and address the underlying psychological factors contributing to his drinking. That combination, peer support and individual therapy, is very common and often successful. It addresses both the social and the individual aspects.
It definitely sounds like recovery is a marathon, not a sprint.
Mm-hmm.
So how do people prevent relapse and maintain sobriety over the long term?
Absolutely. That's a great way to put it. Addiction is often a chronic condition, much like diabetes or hypertension. That means relapse can be part of the journey. It doesn't mean failure, but it's something to plan for.
So recovery isn't just about stopping.
No, long-term recovery focuses not just on stopping substance use, but on building a fulfilling life without it and developing strategies to maintain that sobriety.
What are some of the key strategies for staying on that path?
Building a strong and supportive network is vital. This often involves ongoing participation in therapy groups or 12-step programs, maintaining those connections and accountability.
Oh, why?
Developing healthy coping skills is also essential. Learning effective ways to manage stress, identifying personal triggers for use and having strategies to navigate them. Finding enjoyable, healthy alternative activities.
Makes sense.
And regular check-ins with healthcare providers can also help monitor progress and address any emerging challenges proactively.
The source gives us an example of Sarah. What was she doing to support her ongoing recovery?
Sarah, who was recovering from alcohol use disorder, made attending AA meetings a regular part of her routine for that continuous support and connection.
Right.
She also proactively incorporated healthy coping mechanisms like practicing yoga and journaling as ways to manage stress so she wouldn't turn back to alcohol. The key insight with Sarah is that active, consistent engagement and strategies that support her sobriety.
You touched on this earlier, but it seems really important. The connection between substance use disorders and other mental health issues. Why is it so critical to consider both?
It's absolutely critical because the rate of co-occurrence is just so high. Many people struggling with substance use disorders also experience mental health disorders, depression, anxiety, PTSD.
And they affect each other.
Definitely.
Yeah.
These conditions can exacerbate each other. It creates a more complex, challenging situation, like someone with anxiety might use substances to self-medicate, which then can worsen their anxiety long term. It's a vicious cycle.
So just treating one doesn't work.
Often, it's much less effective. Treating only one without addressing the other significantly increases the risk of relapse for both conditions.
So what's the most effective way to address these co-occurring conditions then?
The most effective approach is what we call integrated treatment.
Integrated treatment.
Yeah. It means addressing both the substance use disorder and the mental health disorder simultaneously and in a coordinated way. Ideally, the same team of providers works together on a comprehensive treatment plan.
So everyone's on the same page.
Exactly. It ensures treatments don't work against each other and that the person receives holistic care.
What might integrated treatment actually look like in a real-world scenario?
Well, it could involve psychiatric care, maybe medications and therapy specifically for the mental health issues, alongside the evidence-based substance use disorder treatment, like individual or group therapy, support groups, maybe medication-assisted treatment for the addiction itself. The crucial element is that coordination of care.
The source provides an example of Tom. What was his experience with integrated treatment?
Right, Tom. He had been diagnosed with PTSD and also had a history of alcohol use disorder.
Okay, a common pairing.
Very common. He received integrated treatment that specifically combined trauma-focused therapy for his PTSD with interventions aimed at his alcohol dependence. By addressing both the underlying trauma and the substance use together in a coordinated way, his treatment was much more effective than if only one issue had been tackled alone. It really highlights the power of treating the whole person.
This really underscores just how multifaceted these disorders are. So, thinking about nurses again, what crucial roles do they play in supporting people through this really challenging recovery process?
Oh, nurses are absolutely indispensable in substance use recovery. They have such a wide range of vital roles, really at every stage.
Can you outline some of those key responsibilities?
Firstly, assessment is critical. Nurses are often the first point of contact. They're skilled at identifying those early signs and symptoms, using observation, interviewing, screening tools. Education is another huge one. Nurses provide essential education to patients, to their families, about addiction's impact, the importance of treatment, relapse prevention strategies.
Support too, I imagine.
Crucial emotional support and guidance. throughout the whole journey, providing a listening ear, empathy, encouragement. And finally, nurses act as vital advocates,
Advocates how?
helping patients navigate the often complex healthcare system, ensuring they get access to comprehensive care, including mental health services, connecting them with community resources. They really empower patients to get the help they need.
Can you give us a practical example of a nurse making that kind of difference? The source mentions Maria.
Yes, Maria's case really illustrates that multifaceted role perfectly. Maria was a 30-year-old mother. She sought help for cocaine use after her family expressed their concerns.
Okay.
The nurse's assessment went way beyond just asking about her drug use. They explored her emotional well-being, her family dynamics, and uncovered a potential link between her substance use and unresolved childhood trauma.
Wow, so digging deeper.
Exactly. Based on this comprehensive understanding, the nurse was key in developing Maria's recovery plan. It included individual therapy for the trauma, family therapy to improve support at home, and medication-assisted treatment, or MAT, to help manage her cocaine cravings.
So a really tailored plan.
Right. And the nurse's ongoing support, education, and advocacy were instrumental. Maria felt more empowered, started developing healthier coping mechanisms. It really shows how nurses can be that central point of care and support.
It's so clear that understanding substance-related and addictive disorders is just so much deeper than knowing a list of substances. It's about grasping that intricate web biological, psychological, social factors, and the absolutely vital role of comprehensive, compassionate, integrated care.
Absolutely.
You know, for anyone listening, especially if you're juggling that mountain of information, like maybe that incredible nursing student we were thinking of at the start,
Yeah.
this can all feel like a lot. I get it.
It really can.
But remember, breaking it down piece by piece, just like we've tried to do in this deep dive, makes it so much more manageable. See, you're already building a much clearer picture. You've absolutely got this learning thing down.
You really do.
And seriously, if you ever feel overwhelmed by it all, just pause. Take a good, deep breath. Remember how much you're already learning, and honestly, how much you care.
Yeah.
You're doing amazing.
Keep going.
You got this.